Hey friends, welcome back to Guess What? Compliance Can Be Simple. I'm your host, Dr. Natasha Guess, and I'm the founder of Guess Compliance Consultant LLC, where I work with small and mid-sized practices to help build compliance systems that actually function in real work. Now, we are starting a brand new series today called Compliance in the Operation. And I want to begin this series the same way I begin almost every conversation I have with a new client. And that's with a question. Has your organization completed a formal compliance or HIPAA risk assessment within the past year? I want you to actually sit with that. Don't just hear it and move past it. Actually think about it. Now, if your answer is yes, that is a great starting point. But the follow-up question to that is just as important. Did that assessment actually translate into operational action? Or is it sitting in a folder somewhere? Was it completed but not implemented? Was it documented but not activated? Now, if your answer is no or you're not sure, you're in good company. That is the most common answer that I hear from practices across the country. And it is exactly the gap this series was designed to close. Now, let me start with the thing I most want you to understand about why healthcare practices fail at compliance. It's almost never intentional. Healthcare compliance failures rarely happen because organizations or practices set out to ignore regulations. They happen because the practice or organization grew and the compliance systems did not grow with it. Now, I want you to think about what happens inside a healthcare organization or inside your practice as it scales. You have different staff members, so staff roles change. New technologies get introduced. Vendors gain access to your patient data. And sometimes your documentation systems expand. Your patient volume definitely increases. Now, each one of those changes brings in new compliance responsibility. And in most small and mid-sized healthcare practices, those responsibilities accumulate without a corresponding update to the systems designed to manage them. I've seen it time and time again. Now, I know that the organizations are not careless. It's busy. Growth is happening. Priorities are competing. And compliance, which does not always make noise until something goes wrong, gets deferred. Until that moment where a complaint is filed with OCR, a patient would like to know why was a record accessed when no one had reasons to actually access that patient information. This is the pattern that I see over and over again. And it's entirely predictable, which means it's entirely preventable. But before we can prevent it, we need to be clear about what compliance actually is. Because I think compliance is one of the most misunderstood concepts in healthcare operations. Most people hear the word compliance and they automatically think regulations. They think I need checklists. They think legal obligations that live in a policy manual and gets addressed once a year during training season. That framing is incomplete. And it is one of the reasons compliance systems fail. Compliance is not a checklist. It is an operational expression of accountability. It ensures that organizations or practices protect patient information consistently. It ensures that care is documented appropriately. And it ensures that oversight of vendors is maintained. It also ensures that if there's an incident, they're responded to effectively And it ensures that your staff are trained on the responsibilities specific to their job role. But here is the most important part of that definition I would like you to know. Compliance becomes visible in everyday operational decisions. Now, if you look at it, when a staff member sends patient information through, say, an email, compliance is present in the communication system they use and the training they received about that system. When you have a vendor that accesses patient data, compliance is present in the agreement governing that access and the ongoing monitoring of that relationship. When you have a patient that their record was accessed, compliance is present in the access controls that determined who could open that file and the audit trail that logged it. Every one of those moments is an operational moment, and every one of them falls within the oversight responsibility of a practice manager, a practice owner, or a COO. Now, whether or not compliance appears in the job description, it still falls to you. And this is what I want you to carry out of this episode. Compliance is not something that happens in a legal department or a policy review meeting once a year. It's something that happens every day in the operational decisions your team makes. And the leaders who understand this are the ones who build practices that can withstand regulatory scrutiny. And it's not because they're perfect. It's because they have built systems that demonstrate accountability consistently. And that consistency is what regulators are looking for. Now, in the next episode, we're going into the mind of a regulator. We're going to talk about the 3 principles that shape how regulators evaluate organizations and the 3 questions every regulator asks. Now, understanding those questions will change how you think about every compliance decision your practice makes. Before I let you go, I want to make sure you know about something, a resource I built specifically for practices in exactly this situation. If today's episode made you realize your compliance systems have not kept pace with how your organization or practice has grown, the Guesswork Ends Here 30-day HIPAA compliance template kit was built for you. It gives you a 28 done-for-you compliance documents across 7 sections, plus a 30-day implementation roadmap so you are not starting from scratch and you are not guessing at what comes next. It is available now at guestcomplianceconsultantllc.com/the guesswork ends here, and the link is in the show notes. If you want to move from knowing where there's a gap to actually closing it, that is where you start. I'm Dr. Natasha Guess. Thank you for listening to Guess What? Compliance Can Be Simple. And if this episode also made you think about where your compliance systems stand in the entirety, I would love to have that conversation. You can also schedule your free compliance strategy call using the link in the show notes. I will see you in the next episode. Until then, keep it simple, stay compliant, and protect your patients.